Well, warm greetings to all of you. My name is Bill Robinson, and I am the president of ADA Business Innovation Group, which is the group that sponsors ADA practice transitions. And I want to thank you for joining us today for the Mentorship-to-Ownership information session. We're excited to talk to you and share with you this offering that we're making available through ADA practice transitions. I do want to let you know that the webinar is being recorded and it will be available later so that you can review it or share it with other folks. This is not a session where there's CE credit available, and wanted to make sure you knew that. And then as we go through the webinar, if you have any questions at all, there is a button on the bottom ribbon there of your Zoom frame that says Q&A. And if you click on that, you'll be able to ask your questions through there. And we will respond to every question that we can during the course of the webinar. And if there are too many questions and we have to respond to some afterwards, we will send those out through an email afterwards. But thank you all so much for being here. And with no further ado, I would like to introduce Dr. Suzanne Ebert, who's going to be your main presenter today.
Hello, everybody, and welcome again. I am going to share my screen here. Bill, I'm going to ask you to confirm that you are seeing my slides.
I am indeed. Looks good.
Wonderful. Thank you. Well, welcome to everyone once again, and thanks for joining us this afternoon or evening to learn a little bit more about a transition path that might just be perfect for you, especially if the other more traditional ways to transition just don't quite seem to fit your needs. I am having a little bit of trouble here. I'm Suzanne Ebert, and aside from being a little bit technically challenged, I'm a general dentist. And just for a quick recap of my career path, it's been a little bit convoluted. I started out my own practice from scratch about a year after finishing a GPR. And then after over a decade in private practice, I had to sell because of some health concerns, but I was in no way done with dentistry. So I went into a public health and educational type setting as the dental director at a federally qualified health center. We were also an extramural rotation site for senior dental students. Because of those experiences and gaining a real understanding of the challenges that dentists face as they launch and retire from their careers, I now work for the American Dental Association Business Innovation Group, where we at ADA Practice Transitions are looking out for you and finding new ways for you to transition into or out of dental practices. So, why are we talking about mentorship? After all, ADA Practice Transitions is a transitions company. Well, a significant part of our corporate vision is to support independent dentistry. And as you may or may not be aware, over the last year, dentists have been facing some huge issues. And tonight, we're going to be talking a little bit about those issues, some of the problems, and present some potential solutions. So I get a lot of questions about why the program was conceptualized in the first place. So let's face it, it's a lot easier to just stick to the basics. Sell a practice outright to a doctor who wants to buy it, or bring in an associate to work for a couple of years and then sell the practice to them. These are really the most common scenarios, and they're pretty straightforward. But what about those practices and doctors who just don't quite fit the formula for one of these more common transition paths? What about them? Who are they? And why are we even concerned about them? Well, let me tell you, as a former private practitioner and a devoted member of the profession, I really am passionate about keeping the private practice model alive and well. So when I started hearing about the challenges that our doctors are facing right now, both owners and recent grads, I knew we had to come up with a transition path or model that made sense for these two groups and truly could become a win-win for all concerned. So every dentist on this webinar needs to really understand and appreciate the challenges that are being faced by our colleagues. Let's talk through a few of these together. Now, as Bill said, I want you to feel free to use the chat feature. Let us know if you have any questions or comments about any of the material that's being presented. I know that they will happily interrupt me so that we can address your concerns in real time. So what about our lovely recent grads? Our 20 and 21 grads have had less clinical time than their predecessors. Now, does that mean they're clinically incompetent? Of course not. The schools are doing a fabulous job of educating these doctors and making them ready to join the profession. It just means that many times what I'm hearing is that they're a little less confident in their abilities. And of course, they've got less experience dealing with tough clinical situations. They want and they need to have someone that they trust and respect to turn to. And they really need them there at a moment's notice sometimes. Where are our grads going? We all know that corporate positions are easy to find. The promise is that they're going to increase your speed, and many times they promise that you're going to have a mentor right there. This is all great stuff. Unfortunately, they often have hidden clauses in the contracts that can make it difficult to focus on quality, and sometimes the emphasis isn't really on patient relationships. So what about private practice? I mean, that's definitely got to be the best thing, right? Because here we have a long-standing practitioner who's willing to take a young dentist under their wing, work alongside them as they show them the joys of owning a business while providing comprehensive care to grateful patients. I mean, what on earth could be better than that? Well, the reality is that many times the owner doesn't have a good transition plan in place, or they simply don't have the patience, space, or production to accommodate another doctor. Their hearts are often in the right place, but the associate is left doing kind of the cleanup work that the owner doesn't really want to do. So the associate might end up doing hygiene and simple restorative, which, just to be honest, it doesn't give them the clinical experience they need, and it doesn't pay the bills. Speaking of the bills, they are graduating with massive student loan debt. Unfortunately, in many cases, what I hear is that is combined with living maybe a bit beyond their means while in undergrad. This is another just really common theme in my conversations with many of my recent grads. Some schools have financial counseling, which they may or may not have taken advantage of. Anyway, the end result in many cases is a low credit score and a high debt load, and that makes the banks cringe. So our dentists are often told that they need a couple of years working under their belt before they should even consider large purchases like houses or practices. Some listen, some don't. Those that do generally find that they can clean up their credit scores and pursue their dreams within about 1 to 3 years. But they really have to be committed. And as we all know, life can get in the way of those commitments. Keep in mind that the average age of our dentists entering the workforce right now is 29 years old. What does this mean? They're getting married, or they've been married often to each other, it seems. They're having children, and with so many having 2 working partners, they're just really concerned about finding just that right work balance in their lives. They want to put down roots immediately, sometimes maybe a little too quickly, because many aren't taking the time to evaluate the decisions that they're making in light of their longer term goals. So, speaking of those long-term goals, I want to present a statement that I want to kind of take on head on right now. So for all of my owner doctors, have you ever said or heard this? New graduates, they just want to be associates. They don't want to own a practice. No desire for practice ownership. If you've heard this, or if you've said it yourself, I'd like you to consider the numbers. 51% in 5 years and 86% in 10 years want to own a private practice. Keep in mind that this is what our 2020 dental seniors said. They have that entrepreneurial spirit. They're intelligent. They want to control their own destiny. And at least while they're in school, they see ownership as the answer. So think about this when you hear that statement. If we as a profession can't find ways to reconcile the challenges that I just identified with this desire for ownership, this group might decide that being an associate really is their only and best option. If so, we will have contributed to the very thing that we're trying to protect, which is independent dentistry. Is it all about our recent grads? No, of course not. It's not. There are many challenges that are facing our owners as well. And I want you to understand that the ones that I'm outlining are not new. They've just become a bit more prominent after 2020. What we're seeing is that many doctors in their late 50s and early 60s are essentially saying, you know what, I'm done with clinical work. If I could get out tomorrow, I would. Now, that doesn't mean that they want just anyone to take over their practice. They really care about the patients and the staff. They're simply a bit burned out. The last year really did a number on them. Some actually found that being forced to take a 3-month hiatus from going into the office every day was not such a bad thing. What they really want now is to pursue their bucket list items. But guess what? They don't have a transition plan in place. And for whatever reason, the traditional paths just don't fit for them. Maybe the practice is located in a harder to sell area. Maybe they don't have the space or the production to work alongside another doctor right now. The practice is supporting one doctor just fine, and they don't really have the energy to build it up to a 2-doctor practice. Maybe they just need their health insurance benefits for a couple more years. Their options become to walk away or to continue to work until a buyer, sometimes any buyer, is found, but they don't really want to do either one. They're concerned about their patients and their staff and their community. They want the practice to continue. They're just struggling a little bit with how to reconcile that with their feelings of, you know what, I'm just done. So, as these issues have come to light over the past year, we thought we would work to find a way to connect these two groups. And lo and behold, we developed the Mentorship-to-Ownership transition path. We want this to benefit both the owners who are ready to get out of clinical dentistry and our recent grads and incoming docs who are interested in ownership, but they're just not quite ready to take the plunge. So we want this to be a win-win for everybody. So who is it for? Is it for just anyone? You know what? Of course not. There are other more traditional paths that might make the most sense for certain practices and doctors. The question really is does it make sense for you? When would a practice owner consider this type of transition path over a traditional associate to ownership path or a full buyout? Well, number one, they need to be ready to step away from clinical dentistry. And perhaps harder than saying you're willing to step away from clinical dentistry, are you willing to give up control of the patient care to a younger, less experienced doctor? Balance that with, are you able and willing to be on site kind of whenever you're needed? Probably a lot during the first year or so. Here's the kicker. Are you willing to potentially take a smaller salary in order to maintain whatever benefits of ownership that you're really looking for? What do I mean by that? How does this work? Well, the mentee is going to come in and take over all the clinical aspects of ownership in your practice. If you are going to throw some numbers out there, bringing home $200,000 a year, are you willing to guarantee that mentee a living salary, and you will actually take the lesser of the two salaries? If so, then you want to consider whether you could potentially be a great mentor. Because let me tell you, I learned a very important lesson over the 6.5 years that I spent working with senior dental students. And that is that great professional mentors are not born. They are made, and often it feels like a trial by fire. When I think about my approach to guiding one of these young dentists through, I don't know, extracting the mesial root that's curved on number 30. When I think about my approach when I started working with them as opposed to 6.5 years later, I have to tell you that I barely recognize how it was when I started. I thought, it's my job to show that doctor how great my technique was. I didn't hesitate to jump in and take over at the first sign of a struggle. And oh, wow, I was really a bad mentor. I did learn, however, and towards the later years, I learned to troubleshoot situations with them beforehand, made sure that they understood the potential complications. And then I learned the most important lesson of all, and that's how to back off and let them find their own way. If I did need to jump in, it was done in a way that allowed the dentist to keep the confidence of the patients and the staff. I learned that a great mentor is so much more than a great clinician. And as an added bonus, by my learning to engage with them on a different and more professional level, I learned so much about newer materials and studies and techniques that were out there. And this led to a huge increase in my own knowledge base. Really couldn't be happier with the result. So, what about the mentee? Could you see yourself as a potential buyer? Are you certain that you want ownership, ideally within 3 to 5 years? Do you feel confident enough in your clinical skills that you really just need somebody there as a potential resource? You don't necessarily need somebody looking over your shoulder. Do you want to learn more about the business of dentistry? And are you really ready to learn from somebody else? If so, consider whether this could be for you. Some things to ask about yourself. Do you kind of understand what your limitations are? What are your strengths? What are your weaknesses? Are you able and willing to take constructive feedback, and especially when it's delivered from professional to professional? Are you conscientious? Is this something that you really want, and are you willing to work at it? Are you willing to learn from others? Do you have that curiosity about kind of what's the tried and true methods, what's working in this practice? And are you able to project confidence? We always called it the fake it till you make it syndrome. If you project it, the patients will feel it, they will trust you. And the same goes for the staff. So we've talked a bit about the mentor, we've talked about the mentee, but guess what? We also have to talk about the practice. Is your practice set up for something like this? I'm going to do a quick walkthrough of these because we really don't want a practice that's too busy. Why not? Because the mentee is not going to be able to handle the same type of load that you as the mentor have been able to handle, which is why we recommend that the practice be operating right now at no more than 4 days a week. 3 is probably better, because what you can do in 3 days, the mentee is probably going to take 4.5 to 5. 2 to 4 operatories is just about right. 2 operatories for the doctor, a doctor for the operatory for the hygienist, and then 1 overflow. We don't really want to be in an area that's completely saturated with other dentists. Now, why would that be? Well, quite frankly, it makes it harder for the patients to leave if it's taking a lot longer for that recent grad to do the same procedures. Is the practice mainly focused on general dentistry? Obviously, recent grads are going to be more comfortable with general dentistry. If there are specialty procedures that are performed in the office, then contractually, you want to make sure that there's a timeline where the mentee would learn those procedures and take them over from the mentor. This one's really non-negotiable. You want to make sure that the office systems that are in place are really, really fabulous. You want to have good policies. You want to make sure that the staff is really well trained. The last thing we want to do is bring a recent grad who's needing to focus on clinical skills to have to worry about refining office systems. So let's have those already in place. If you even think that you can see yourself in these outlines and you're curious as to what to do next, you're going to want to do a few things that will put yourself in a really great position to become a part of the mentorship-based transition plan. So for the practice owners, first of all, go ahead and get evaluation. Start the process early. The reason for this is that you want to determine the purchase price, or at least the method for determining the final purchase price up front. This all needs to be set at the time the mentee commits to purchasing the practice, which is going to be within about 6 months of them joining the practice. Think about what makes your town a great place to live. You can check with the Visitors Bureau. Neighbors and staff are great. Then compile it into a list for potential buyers. You want to think about the schools, the recreation, shopping, and oh, by the way, if Amazon is coming to town, we definitely want that to be out there. Have an agenda in mind for when the potential mentee comes out to view the area, because this is a really good time to show off a little bit. Now, whatever you do, keep an open mind about the potential successors for your practice. Decide what's important to you professionally and don't allow personal preconceived ideas from considering potential candidates. This is really crucial to your success. We have more women and minorities graduating from dental schools every day. Don't miss out on a great candidate because you can't see past your own biases. So what about the buyers? They have some things to do too. Interview at least 3 banks. Starting these conversations early puts you in control of the process. Find out how much you may qualify for and find out what you need to do to strengthen your application. Put together a plan for cleaning up your credit score. Form a relationship with one of those banks. Preferably find one that has experience with professional loans and get an estimate on the timeline that's going to take you to be able to obtain financing for a practice. We do ask that you consider a smaller market. These practices are some of the best kept secrets in dentistry. Overheads are a bit lower and there's a lot less competition. You can really make a great living on a part-time schedule. Just ask some of the owner docs who are right now owners of these smaller market practices. They're working 3 days a week and they're doing just fine. It's really kind of a great way to achieve that work-life balance. And again, keep an open mind. You want to find a practice that really has what we call good bones. It can evolve into whatever you want. So make sure that you're willing to overlook kind of dated decor if the location, the size, the financials, and the way they approach patient care are all solid. So we've talked a lot about the characteristics of the doctors and the practice, but how does it all come together? Well, with us, the first thing you're going to do is to create your ADA practice transitions profile. When you create your profile, you're going to be asked a lot of questions. For our owner docs, make sure that you're showcasing your practice with all of those photos that we've talked about. You want the doctors to be able to visualize working in your space. Make sure that you really truly understand your timeline. For our mentees, you want to highlight all the skills that you have. You want to make sure that you have filled this out in the most complete way to fill out your resume. And the most important thing of all, you're going to be asked a number of questions regarding your approach to patient care. We call this the philosophy of care section. And while we know that philosophy of care is vital to the success of any transition and a mentor to owner transition, philosophy of care is hands down the single most important determinant of success. You must share the same approach to patient care and have the same priorities in order to be able to work together to provide continuity of care for those patients and staff. And the two of you don't want to alienate each other. So take some time with your philosophy of care statement. Think about what your mission is. Think about what your goals are. Articulate them. Once your profile has been approved, we'll start looking for candidates for you. Once we find somebody who fits your criteria and the two of you have agreed, you'll conduct a 15-minute screening call. The goal of this call is pretty simple. You need to confirm the goals and expectations and the timeline. You want to make sure that your philosophies align. see if the two of you click enough to have an additional conversation. Because the next step is to move on to a little bit more in-depth evaluation. We suggest either a 1-hour video or maybe a half-day office visit. Learn a little bit more about each other and the way the practice runs. By the end of this meeting, you should have seen the equipment and the office setup. The owners should have a little bit better idea of how this potential buyer communicates and whether it seems like a good cultural fit for both of you. If so, the interview continues. We want you to spend some time together, and we want you to spend some time together in and out of the practice. Spend a few days. Take the time to review charts, shadow each other. Since a successful mentorship is really built on trust, get to know each other outside the practice. Go to a baseball game. Introduce the staff at this point. Go out to dinner. Explore the town. Maybe show some housing rental options. If this seems like a relationship that you want to pursue, then it's time to focus in on creating that relationship. So I'd like to take a step back. That's a long time. We're telling you to take a lot of time to interview each other. The reason this is so important is that the first time you meet somebody, everyone's really on their best behavior. The second time you meet somebody or you spend some time together, you're still putting a little bit on a show. But by the third date, the guard starts to come down. You start to see each other's true colors, and especially by spending some time together, you're going to know whether this is a good relationship. I want you to find out whether you trust each other. Do you treat each other with respect, even when doing something really tough, like evaluating a very challenging case, and hopefully both of you having some strong opinions? Do you respect and treat each other as professionals? Because the only way this works is to have two-way communication. So now you're going to decide whether you want to proceed. And if you do, you're going to work together, filling out the ADAPT contracting toolkit. You're going to agree to all of the terms up front, including compensation, CE allowance, mentor and mentee responsibilities, benefit packages, relocation incentives, the decisions, timelines, if the list goes on and on. At this point, you should have a really good idea of whether you're ready to sign an associate contract. Within that associate contract, there's going to be an additional clause because you're going to give it a 3 to 6 month trial run. Within 6 months, make the decision on whether this is the long-term solution you've been looking for. At this time, you're going to lock in the purchase price, or at least the method for computation of that. The mentee will have lined up a comprehensive plan for obtaining financing and should have a date in mind for the final sale. The docs are going to ensure that everything is in writing, and both parties will most likely at this 6 month point put down some form of financial incentive or penalty for not following through. Our goal here at ADAPT is to find that great candidate and then give both doctors the resources that they need in order to properly manage the details of this transaction. We provide step-by-step guidance for each part of the process and recommendations for legal resources. We're also able to offer a third-party valuation at a very reasonable fee and access to real estate professionals and mergers and acquisitions professionals who can walk you through each step. So, I've thrown a lot of information at you. Let's go ahead and do a recap. So, it all starts with an owner who's looking to get out of clinical practice completely. And they're looking for just the right type of dentist to take over the practice. The owner is willing to accept a reduced income from the practice in order to keep whatever benefit it is that they're interested in. The owner is committed to finding a doctor who shares their approach to the practice, the staff, and the community. We have a newer graduate who knows they want ownership within 5 years. They want someone to be there as a support and a backup while they increase their clinical and business skills. They have a clear vision and they have clear goals. They understand that they still need a bit of time to get their financing in order. And they really don't want to be in a transient practice situation. The practice itself is probably going to be a solo practice, does not have the room for 2 full-time doctors. So around 3 to 4 operatories. It's going to be a profitable practice where clinical excellence is valued. It doesn't necessarily have to be the most updated with the latest technology, although that's always going to be a selling point. It really does need to have very solid financials and policies in place. All the doctors need to be ready to commit in writing to this plan. And hopefully the decision to purchase the practice is made at 6 months. And the timeline should be no more than 3 to 5 years. So how does this benefit our newer docs? Well, they have a mentor that's committed to their success. They're going to learn the business of dentistry and the clinical dentistry at the hands of somebody that they already have formed a relationship with. They're going to purchase a practice that they already know intimately. And again, they're going to know that that owner is fully invested in their success. What about the owner? They get to step away from clinical work. They get to maintain their benefits and salary. They can retire in the future knowing that their patients and staff are going to be in very good hands. And they get to pass on their knowledge, both clinical and business, so that their community can be served well into the future. So what are the next steps? If you don't have an ADAPT profile, it's ADA practice transitions, create one. If you already have one, then go ahead and update it. We're continually making changes to the profile experience to make it just a little bit better. So if you go into your ADA practice transitions account, you will see when you hit edit profile that the matching criteria will have a little exclamation point next to it. If you go down to the question of participating in the mentorship to ownership questions, or program, you can always hit yes. You're going to be asked 4 or 5 questions. And if you would like to be a part of this program, you will be enrolled. Let me assure you, when you enroll in this program, we are not excluding you from any other transition path. This is in addition to other transition paths that might be good for you. So you are not exclusive into this program. We will continue to look for buyers and more traditional models for you where it's appropriate. So feel free to reach out to us if you have any questions or you just need clarification on any of the points that were discussed today. So we are excited to take any questions that you have. And with that, I am going to hopefully, I already told you guys, I am a little bit technologically challenged. I'm going to stop my share. All right.
Great. Thanks, Suzanne. So yeah, like Dr. Ebert was saying, if you have any questions, please enter them in the Q&A. We do have some questions that were asked ahead of time. So I will start with some of those while we wait for the Q&A to start populating. Is this only for smaller market practices?
I would say it's not only for smaller market practices. What I was saying about the ideal practice is that if you're in an area that's less saturated, this particular path is going to be a little bit more potentially in line with what your goals are. Saturated areas typically are going to fit more into one of the more traditional paths, so you may not want to consider this. The other thing that a smaller market practice really has as a huge advantage is, honestly, the patients are going to be a little more forgiving if a crown prep takes 3.5 hours, whereas if you're in an area where the patients have a ton of options and aren't really devoted to keeping that practice alive and well, they might tend to be a little less forgiving. Let's just put it that way. So it's not exclusively for it, but it really does fit well with the narrative.
The next question here is, how long of a mentorship period do you recommend?
Really glad that that got asked. We like to see the entire mentorship practice, the entire plan should really take no longer than 5 years. I would like to see it more at 3. It's going to depend on the clinical experience and the clinical skills of that younger doctor coming in. It's also going to depend on their ability to clean up that credit score and get the financing for the practice. So it does depend, but any longer than 5 years is probably just a little too long. You want to have that commitment within 5 years, and I like to see it at 3.
The next question here is, how much does this cost?
You want me to handle that one?
Sure. I need a drink anyway. This is just water, guys.
One of the things that's different about ADA practice transitions from not all, but many of the brokers is sometimes it's hard to find out what you're going to pay. All of our pricing is completely transparent. If you go to adapracticetransitions.com, right along the top banner, there's pricing, and you click on pricing and you can see what it is. If you are buying a practice and you're the buyer, there's no cost to you for that. If you're an ADA member, these are all ADA member prices. If you're selling your practice at 6.5% of the selling price of the practice, if you are hiring an associate, it's $4,500. And if you're the incoming who is looking for a job, it's $500, unless it's your first job out of school. And then we waive that $500 fee, so there's no cost to it. all of these prices are only charged when we find a solution for you. So there's no upfront cost. You only pay when we have provided value to you. And in particular, related to the mentorship program, there's no change in the pricing for that. It's the same pricing. If you come into it as an associate, you would pay the associate fee early on in the process. And then when you sell the practice, you would pay the practice selling fee at that time, and we would credit what you paid for the associate match previously.
I'd like to add on to that, that many of you may have come in at a different pricing structure, our pilot pricing. If you have any questions about what your particular pricing is, if you go into your ADA Practice Transitions profile, the left navigation at the very bottom has a button that says Your Account. If you click that button, you will immediately see your pricing at the time that you signed up, and that's what we honor.
Thank you. Yes.
Bill, I'm going to follow up with another question to you. So ADAPT mentions that it is a non-exclusive program. Can you please clarify how this might work?
Sure. That actually follows directly from my previous comment about how it works often with other brokers, whether they're employment brokers or practice sale brokers. Many of them require you to sign an exclusive contract with them, so that if you are working with them and you find a buyer on your own, or you find the associate on your own when you're attending a dental meeting, you are still required to pay them, even if they had nothing to do with finding the solution that you eventually use. With us, you only pay for recommendations that we have made. Now, if you are on our platform looking for an associate, and then you go to that dental meeting and you meet somebody, they're not on our platform, we did not recommend them for you, then you can just come off the platform and you don't pay us anything. Though you would no longer get the help of the ADA advisor toward working through the details of that, which we think has value and we think is well worth it. But if someone is on our platform, you're both on the platform, and then let's say you meet at the dental meeting and we've made that recommendation for you, and then you meet at that dental meeting and say, oh, your name seems familiar to me. We do expect you to pay us under those circumstances. But the main point is we are not exclusive, where we insist that you sign a contract with us that says we're the only solution you're going to consider. Thanks for the question. It's a good one.
And just to follow up with that, Bill, do you want to address if they are signed up with a broker and they have an exclusive agreement, but then we do find a solution for them?
Yeah, that is so we tell folks, make sure if you are using a broker currently. In fact, we've run into this a number of times where folks say, I really want to use ADA Practice Transitions, but I signed up with a broker and I think I have to pay that broker if I sell my practice, anytime in the 18 months from the time I sign, which sadly is true. And so we encourage them, keep going with that broker, see what that broker could come up with, and then please don't extend that contract. When you get to the end of that term, then you can come and submit your profile, and then you will only pay us if and when we find a solution for it. Thanks for bringing that up. It's a good point.
And they would pay us almost a full 50% off discount on typical broker charges. That's something.
That is exactly right.
Yes.
Yep.
Okay, and then I have one last question here. Are most doctors looking to become mentees just starting out in their career?
This really goes back to that study, these studies that have been done through ASDA, the American Student Dental Association. Fully 86% of dental students want a mentor. This is a little bit different because we're talking about a whole different level of mentorship. However, they want the guidance and they want desperately to have somebody who's out there doing it. They want somebody who's out there practicing the way they want to practice, so that they can bounce ideas off of them in real time. So yes, most younger dentists, recent grads, do want a mentor.
Thank you.
Great.
So those are the questions that we have.
Wonderful. Well, thank all of you for your participation today. If you have any additional questions, don't hesitate to reach out to us. Don't forget, come visit us at adapracticetransitions.com, and we hope to be working with you soon and helping you find the solution that gets you to that next place in your career that you want to be, whether it's retirement, ownership, or finding yourself working in a new practice. Great. Thanks, everybody. Have a great rest of the evening.
Thank you, everybody.